Hi, good evening. This is Dr. Kia with Accessible Professionals. We are here for our second episode of the pregnancy series. We have coming on shortly Mocha Midwife or our Nurse Midwife, Certified Nurse Midwife Jessica Flagger. And so we're going to learn about midwifery care during pregnancy, what a midwife does, what services a midwife provides, what type of birthing person is ideal. We hope you like this pregnancy series here at Accessible Professionals. Our goal is to introduce you to a host of professionals that can assist with providing solutions for your concerns, the things that matters most to you, to help eliminate that difficulty of not knowing who to turn to for what type of advice. So hopefully we are streaming on Facebook, Instagram, YouTube, and Twitter. I'm going to bring on my colleague, Jessica.
Hello, everyone.
Welcome, welcome, welcome.
Yeah.
And this is our certified nurse midwife, Jessica, and I'll ask her to introduce herself to the community, a little bit of her background and training.
Thank you for having me, Dr. Kia. As you said, my name is Jessica. I am a certified nurse midwife. I'm entering my seventh year as a nurse midwife here in Detroit, Michigan. My training includes I completed my Bachelor's of Science in Nursing at the University of Michigan, followed by my Master's of Science in Nursing at Vanderbilt University, as well as my Doctorate of Nursing Practice at the University of Michigan. So I'm very excited to be here and talk more about midwifery care.
Great. We are so glad to have you. I think hopefully that is better. We're trying out different platforms of how to stream this well for the different audiences. So those of you who are joining us on Facebook and Instagram, hopefully the video feed is working well for you. All right. So and as we get started, I just want to acknowledge that that our goal here is to be inclusive. And we both recognize that we deal with reproductive health for a particular arm of reproductive health. And so we're going to do our best to use inclusive language. And we ask for your grace for us if sometimes we're not consistent in what we say. But we don't want to offend or exclude anyone who is included in pregnancy and the care leading up to surrounding or any kind of gynecologic care. All right.
All right.
All right. So, my first question for you, Jessica, is tell us about the types of midwives. You have a particular training, and some people may not know that there's different types of training.
Absolutely. So, here in the United States, there are three types of midwives. I am a certified nurse midwife, which is a professional midwife who generally has a nursing background. So, like I said, I completed my Bachelor's of Science in Nursing and then got my master's degree. So, if you are receiving care from a certified nurse midwife, they do have a nursing background. There's also a certified professional midwife, which is a professional person who provides maternity care but doesn't necessarily have the nursing background like a certified nurse midwife. They complete professional education. They require a certain number of births and they have to apprentice with another certified professional midwife before they can become licensed. So, both a certified nurse midwife and certified professional midwife are licensed professionals in the United States. The third type of midwife is a lay midwife who provides maternity care but isn't necessarily licensed in the United States. So it's very important when you are meeting with a midwife or interviewing a midwife to ask, what type of midwife are you and what type of professional training have you obtained?
Awesome. And so you have a certified nurse midwife provider training. And then another question would be who is the ideal, what is the type of birthing person that would be an ideal person to get their care from a midwife?
Generally, we say that an ideal person would be a low risk birthing person should receive care from a midwife. In the world of obstetrics, we tend to classify women as low risk and high risk, depending on their predisposing risk factors and their pre existing health conditions. So, someone who is high risk may be someone who has pre existing diabetes or chronic hypertension requiring multiple medications. And someone who is low risk, this may be their first child, they have no pre existing health conditions, and they desire a healthy, safe birth. So, midwives traditionally tend to care for birthing people who are low risk, but depending on the area of the United States that they work in, it may be difficult to work only with low risk women. So, most women end up experiencing collaborative care. So, midwives care for women who may be on the high risk spectrum, but they get care from a midwife as well as a OBGYN.
Awesome. And we were talking about the different care that might overlap between our specialties. So, for the audience who may not have seen my introduction in the past, I am a maternal fetal medicine provider. And I have absolutely loved working with midwives at the different practices that I've been a part of. Um, One of the things we talked about is that for me as a maternal fetal provider, I might need to assist that pregnant person with starting off pregnancy safely, maybe introducing some things at the beginning. Um, and I might need to help in the middle, but the birth may not be the part that's higher risk. And so sometimes it's helpful to work with a nurse midwife for that birthing person that wants a particular experience that may be better suited with a midwife, and I can assist them with the prenatal care, and then we can team together to maybe have a low intervention, more in tune with what that birthing person is looking for, and in the really in the wheelhouse of the midwife who's quite experienced with a host of things that frankly, I may not have been taught.
Absolutely. And I completely agree with that. I think that for the future of obstetrical care in the United States, that collaborative model that you just described would benefit women greatly. Midwives, when we're trained, we focus on physiologic birth, which is birth with very low interventions. And we believe that that is the safest way to facilitate a healthy and safe delivery for the birthing person. But we, like I said, we understand that sometimes complications do arise. So having a relationship with an OBGYN, as well as having the expertise of a midwife when it's time for the delivery, it's like having the best of both worlds.
Yes. Another question that I have for you, um, I guess, can you explain a little bit more who might be low risk? Maybe some characteristics that you would consider a low risk pregnant person?
I would consider a low risk pregnant person, not necessarily based on how many children they've had. Sometimes when you think of low risk, you automatically think of a woman's first baby. She hasn't had very many children. But traditionally, low risk just means having few pre existing health conditions such as diabetes, high blood pressure, thyroid disorders. Low risk women generally consider themselves healthy. In the obstetric community, we label women high risk when they have, morbid obesity or uncontrolled diabetes. So if you are a person who generally considers yourself healthy, then I would consider you low risk.
And I'd like to talk about birthing locations. So, amongst the midwifery spectrum, different providers might assist delivery in different places. Can you talk through for our audiences listening about different locations midwives might work?
Absolutely. Certified nurse midwives traditionally deliver in hospitals. So, if you are looking for an in hospital birth, you may be able to find that option with a certified nurse midwife. But there are midwives who deliver at home, they provide home birth services. Or a freestanding birth center, which is kind of like the halfway point between a home birth and a hospital birth. A home birth, you would generally plan that with the home birth midwife in advance. They have certain criteria that you would meet in order to qualify for a home birth. Not everyone qualifies for a home birth, and that planning piece is essential to ensure a safe and healthy delivery. A birth center, like as I said, it's a halfway point between a hospital and a home. Some people aren't completely comfortable with the idea of delivering at home, but they don't necessarily want all the medical intervention of delivering in a hospital. So the birth center offers the best of both worlds in that case. Usually there is quick access to a hospital in case things escalate and hospital care is required, but there is a home-like environment. So there's a bed that's big enough to fit the whole family. There usually aren't so many monitors and noises that usually come along with delivering in a hospital. So a birth center is also an ideal place for a low-risk woman to deliver. And then, of course, you have the hospital, which is the most common place where people give birth these days in the United States. Generally, if you're delivering in the hospital, you may have continuous fetal monitoring, an IV running, providing fluids. You have access to pain medications if you choose to use those during labor. And you also have access to an epidural if that is an option. Whereas in a birth center and at a home birth, epidural wouldn't be an option. So I generally recommend that women consider what interventions you're interested in using during your delivery. What is your ideal space where you feel safe and you feel comfortable, and then exploring those options afterwards.
I think that's awesome. I think it's important to highlight autonomy. It's one of the medical ethics of healthcare is to support an individual's choice, and so we really want birthing persons, mothers, to know that um, that your input is really should be equally part of the conversation. Um, and then also then have that discussion with your prenatal provider about whether or not certain locations are ideal for you as an individual and the
Right.
situations and the characteristics of the pregnancy, or whether you can get a similar feel, a similar style of care, similar provider, but maybe in a location that has some safety nets. And as a lead in, I do want to drop this as an appetizer that we would love to have Jessica on for a hot topic talking about home births, which I'm sure it's not a surprise that that's a controversial topic amongst
Yeah.
prenatal providers. And so I think it would be interesting to have a discussion about the different perspectives. Are people in my area of work blowing the concern out of proportion,
Mm-hmm.
um, and are we afraid more than we should be, um, or are there some things that lay people may need to know about those choices, or are is it also unclear about who's the best person to even consider that, or and
Exactly.
I think at the heart of that discussion is autonomy and
Mm-hmm.
the experience that birthing persons want to have, and whether or not they're getting that experience from providers in the hospital. And I think somebody from my profession needs to account for what we are doing right and
Absolutely.
what we're not doing right. That might be adding to that equation. um,
For sure.
so that might be an introduction. I'd love to have Jessica back on for hot topics where we can go over at length the all of the buzz about home births.
I love
So
that.
speaking of where to deliver, there is a scientific publication. So in the medical community, we send out information from research that we do to kind of get that information out there amongst our colleagues. And we have these journals, kind of like editorials. They're called scientific journals. And so there's a journal, the American Journal for Obstetrics and Gynecology, also called the Gray Journal. It is a journal for obstetrics and gynecology. They have in this month's edition, the January 2022 edition, an article about a summary of care that happened. They looked at one particular state, well over, I think, 20,000 deliveries, including the mothers and the children, and how they all did in terms of safety, the outcomes. And they evaluated doctors in the hospital, for the most part, that's where doctors attend deliveries, is in the hospital. They looked at nurse midwives in freestanding birth centers, like Jessica just mentioned, something that's not necessarily in the hospital, but might be near a hospital, and it's an in-between having a home birth or having a birth in the hospital, some kind of like middle ground type of experience. And then they also looked at nurse midwives in the hospital setting. And what they found in this study that's out currently in the Gray Journal was that the safest location for delivery was in the hospital. So comparing home birth, a freestanding birth center, and the hospital, the safest place. And so they concluded that birthing persons should know where the safest location is. And these were all low risk moms, so that's important that we keep an apples to apples discussion. So all the mothers were low risk, and so they thought that the safest place, especially in terms of newborn outcomes. Now, one of the things they did not conclude, but was in the information, was that the safest person to attend the delivery was the nurse midwife. And I thought that was amazing. And honestly, I think that will be a great follow-up discussion. But I think it's important for us to acknowledge that nurse midwives have a wealth of training, and
Absolutely.
and I think the focus of that training is very different than maybe how obstetrics started from its kind of paternalistic roots. And it may be more low intervention, and sometimes less is more. And I mean,
Mhm.
I think that's an important part of knowing obstetrics, when you're being just a busybody, and when you're doing something that's actually being productive, when you don't need to touch that person, and when you can let their body do what it needs to do and be patient as long as everything is going well. So shout out to the nurse midwives who
Thank you.
I wish the journal had concluded that. Maybe they didn't want to highlight that point, but I saw it. um, so so shout out to nurse midwives. I think
Thank you.
there's room for birthing persons to see a host of safe providers, and I'm just here to make sure that people know their options and to try and elevate.
I think
Go ahead.
like you said, it highlights the value added of having a midwifery care on staff in a hospital. Like you said, midwives are high touch, low tech. So we trust our instincts, we trust our intuition, and we trust women and birthing persons. So we want everyone to know that having a birth in a hospital with a midwife is a safe and wonderful experience.
We have some questions that are coming through. What kind of training did you receive to become a midwife? So I don't know if you want to summarize again, Jessica.
Yeah. Absolutely. I received my Bachelor's of Science in Nursing from the University of Michigan, and that was a 4-year degree program. From that point, I could have decided to work as a registered nurse or go straight to my Master's of Science in Nursing program to become a nurse midwife. And I chose to go straight through to my Master's program because I knew that there was nothing else that I wanted to do. My Master's program took about 2 years. We started off in the classroom learning about the history of midwifery, the fundamentals of midwifery care, and then we transitioned into our clinical rotations, where I personally traveled to 3 different states to shadow with some and precept with some wonderful midwives in Washington, D.C., and Tennessee, and Houston, Texas. And nurse midwives are required to attend at least 40 deliveries prior to graduation. And that number varies from program to program, but the minimum is 40. And to be comfortable in the delivery room prior to graduation. So we get a wealth of experience, hands-on experience, as well as the clinical and evidence-based knowledge that we need to provide safe maternity care.
We have another comment from Nicole Bianca Robbins. Midwives rock.
Thank you. I agree.
All right. As maybe my colleague can type one more time. I'm having a hard time seeing some of the chat because my
Okay.
look seems to be in the way. But there are questions that are continuing to come in. All right. And so then let's talk about maybe some things that you think are common knowledge, some areas that might be misunderstandings.
Mhm. I think there are a few misconceptions when people hear that I'm a nurse midwife. Generally, they think that, oh, midwives were a thing of the past, or they remember their grandmothers talking about midwives when they were growing up. But midwives are definitely becoming more accessible by the day here in the United States. We are very popular in mainstream these days, and the care that we provide is very reflective of our current state of maternity care. So that's the one thing I want you to know, that midwives are still around. We are growing and we are a thriving profession. Um, People also think that maybe midwives aren't educated as vigorously as other professions. And I'm also here to debunk that knowledge. Midwives are highly educated in a very rigorous fashion and very well trained when we do graduate from school. Some women who are in the hospital having their baby think that once they get an epidural, they won't need a midwife anymore. And I think that is untrue. And I'm here to debunk that myth as well. Even with an epidural, there are skills that midwives have and interventions that we can help you, out to perform so that way you still have a safe vaginal delivery. This can include different positionings, so we'll help you maybe get in the hands and knees position or birth on your side, so that way we can still simulate movement even though you're in the bed with an epidural. And now that midwives are becoming a little bit more popular, a little bit more mainstream, sometimes people get midwives and doulas confused. And I'm just here to say that we are both essential to the safe and healthy delivery, but we do very different things. The midwife is the healthcare professional, the clinician, and the doula is the support person. So they are solely focused on you. When you hire a doula, you are the only person that she tends to. She stays with you for the entire delivery process. Whereas a midwife, I might have 3 or 4 different people in labor. I might be hopping from room to room, but I still know what's going on with all of my clients. So we provide different services, but our goal is to achieve the same thing, which is a safe, healthy delivery.
We have a question from Lexi09. Is it true that when you work with a midwife, unlike an OB, you will for sure be present during birth? So I guess the question is, are you guaranteed to be at the delivery?
That's a great question, and I would say it depends on which practice you choose to, birth with. Oftentimes, in a hospital-based practice, midwives work in shifts, so we work in 12-hour shifts. So I would work from 7 a.m. to 7 p.m., and one of my colleagues would come in from 7 p.m. to 7 a.m. So it may not be me specifically who is at the delivery when you come to have a baby, but there usually is a midwife in the hospital at all times. That's a wonderful question to ask when you are interviewing midwives. Do you have 24/7 hospital coverage? Because generally within a practice, all the midwives tend to believe the same things and practice the same way. And we often encourage women to meet as many of us as possible, just in case one of us is there for the delivery.
Joey says, thank you, ladies. This is amazing, Jessica. Why did you become a midwife?
That's a great question. When I was growing up, I always knew that I would be delivering babies in some form. I thought I wanted to be an OBGYN for a very long time, but it was actually my grandmother who encouraged me to go to nursing school. And I had no idea what a midwife was when I went to nursing school. I thought I was going to go into pediatrics. And I took a class my sophomore year at the University of Michigan, and a midwife and a doula spoke at the class. They did a simulation of like a midwife birth, and it kind of felt like the sky opened up. Like, that's what I'm supposed to be doing. So, exactly. So once I learned what a midwife was, that I could be a nurse as well as deliver babies, that sealed the deal, and there was no turning back after that.
Thank you. And thank you, Joey, for asking that really individual, personal question. That's sweet. All right. I have some more questions.
Okay.
Um, what does birth look like with Jessica in the hospital?
Yeah. Birth looks like whatever you want it to look like. That's generally what I say, and I try to achieve that in a safe and healthy way. So generally, a woman who seeks, or a birthing person who seeks midwifery care, wants a low intervention birth. So within the hospital, trying to manipulate the room, the environment to be as low risk and quiet and calm as possible is something that we try to do as midwives. So that can include keeping the lights really dim, keeping the monitors really quiet, intermittent monitoring instead of continuous monitoring to give you some freedom to move around, allowing you to eat when it's safe, some jello or some fruit or some ice chips or something like that to keep you hydrated and nourished as well. So I try to respect your wishes and your desires while keeping you safe at the same time.
Susan E. asks, what questions should I ask before deciding which midwife to work with? Great question.
Great question. I would, if I was a woman or a birthing person who was interviewing a midwife, I would ask, how long have you been a midwife? How much experience do you have as a midwife? I think that I would ask the same thing about the call schedule in the hospital. Is there always a midwife in the hospital, or are there shifts that go uncovered? I would ask about the C-section rate and the maternal mortality rate in the community. I think those are very important questions to ask as a birthing person. And I would also ask, what is your philosophy on physiologic birth and safe, healthy birth? Sometimes we think that everyone's cookie cutter, everyone believes the same things, but I think it's important to, ask those questions for sure.
Other questions? Let's see. Okay. I also had wanted to know, you know, you are a person of color, and we know that people of color in the health field, I would especially say people that come from the Black diaspora, because there are a lot of persons of color represented from Asian communities um, in medicine. But when it comes to Black persons in health provider roles, that's a significantly smaller percentage. And so I wanted to, if there's anything you wanted to speak on your role, how you, the importance that you feel like you're able to add in this particular way as a person of color.
Absolutely. As a birthing person, when you are looking for a healthcare provider, I recommend the most important thing is to find someone who listens to you and who respects your concerns. You know your body the best, and you know when something is wrong. So I think it's incredibly important that your provider is caring and compassionate and respects the things that you say and the things that you're concerned about. We know that as a provider, it's our responsibility to care for you and to keep you safe. But we can't do that if we don't know what your concerns are. So it's incredibly important for you to feel like safe to speak up and voice your concerns and that they're heard and respected. And if you feel like you're with a provider who is not doing that, it's okay for you to find someone else that you feel can meet those needs, because oftentimes it can be a matter of life and death when it comes to delivering a baby.
Great. So, I think it's important to let people know that different types of providers come from all kinds of backgrounds, and one of the things that I think is really a move across persons of color that work in reproductive health is really to just increase representation. Sometimes we um, connect in different ways. We see things coming from different cultures that might help elevate the care. Sometimes the trust might be a little bit easier, and we know that it's important for an individual to trust their provider, especially when you are at childbirth. I know, speaking from my own personal experience, that was not the time that I did not want to have confidence in who was attending my birth. I wanted to know that when I was fatigued and exhausted and I wasn't Dr. Kia, I was just Kia, that the person who was helping me and the team of providers that were there had my best interest at heart, that when I couldn't speak for myself, they knew my wishes, and that they were going to help me try and achieve a safe delivery for my child and for me. And so I think we just really want to just keep elevating the conversation, letting people know that there are people of color that are nurse midwives around the country that want to have these conversations and help um, other birthing persons of color as well know
Mhm.
resources that are out there for their own health experiences, health outcomes.
Absolutely.
Um, how do you like to work with a doula? I think you might have touched on this before a little bit, but maybe we can summarize it again. We had our doula Ariel on in our last live, and one of the things that she went over is that she's not a medical professional. She's there to support the mother, and so sometimes it may not be so understood that there are different roles. So, how do you like to work with a doula?
Yeah, I'm incredibly comfortable working with doulas. When I walk into the delivery room and I see a doula, I'm like, two thumbs up. I think that they're wonderful support people for birthing persons. I generally like to kind of sit back and see what kind of skills and experiences the doula is bringing to the situation, and respecting the woman and her wishes. She's chosen this person to support her in labor, and I follow their lead sometimes when it comes to getting women in different positions and trying different things that can help maneuver babies out of some pretty wonky positions. So I'm a huge fan of having a doula in the room. I know that the doula is also there to help the woman advocate for herself. So she may be seeing things that I'm not necessarily seeing as the busy provider who may be running from room to room. So I think that they're essential members of the team, and I respect the knowledge and expertise that they bring to the table.
Great, great. Let me make sure we are addressing the questions from our audience. Thank you to those who are watching and sending your questions in.
Yeah, great question so far.
Yeah. So I think, those are some of the things that I wanted to go over for our community that's watching on the different streams. Once again, I am Dr. Kia with Accessible Professionals. This is Jessica Fladger, also Mocha Midwife on Instagram. We have been understanding the role of a midwife in prenatal care. Oh, you know what? One of the things we talked about that we haven't gone over yet, I think, is that you don't just do prenatal care as a midwife.
Exactly. Nurse midwives generally provide comprehensive gynecologic care, which includes preventative screenings such as pap smears, ordering mammograms, routine STI testing, as well as family planning care. That's a large part of the work that we do as well. And I'm a huge believer that being really healthy and being in control of your health when you become pregnant is just as important as the care that you get during pregnancy. So I recommend, seeing either a midwife or an OBGYN or a women's health nurse practitioner at least once a year for those comprehensive gynecologic services that we provide as well.
Oh, this has been such an enjoyable conversation. We just have some thanks from Row Light 38. Thank you. You are amazing. Thank you for all the information. So
Thank
it has been a pleasure. Nurse Midwife Jessica, who is soon to be
you.
a doctor. She is in her doctoral program, which I definitely deserves applause for continuing to get more and more education under her belt. Um,
Thank you.
so it has been such a joy to talk with you and have you to be able to have this discussion with our community about midwifery care. Hopefully, it has been enjoyable. We would love to invite all who are watching to join our Accessible Professionals community. If you like content like this, you want to know which professionals serve the issues that you are having, who's doing what, to take that guesswork out of getting solutions for your everyday concerns. You can join our community. We have a website. It's App Cares for Accessible Professionals, so ap.cares.ca. We can and then we also are on Instagram, Facebook. We are on YouTube. We'd love for you to follow our content. We'd love to have Jessica back for our hot topics about home births. We're also on Twitter,
Forward to it.
TikTok, we're everywhere. So thank you so much. Again, our website is www.apcares.ca, AP for Accessible Professionals. It has been a beautiful night, and thank you to God that the internet did not act up on this side. So for all of you who are watching on the different streams, have a beautiful rest of your Saturday and stay tuned for more.
Thank you for having me.
Thank you.